It's time for our health talk with Dr. Weiner. Today we're going to talk about malaria. Thank you, Doctor, for being on the show with us today.
Thank you very much for having me. Thank you.
Thank you. So on the 25th of April is World Malaria Day. Can you tell us what is malaria and how that differs from dengue?
Yeah, recently we talked about dengue. Malaria was with us, before dengue, and malaria has been part of the health problems in this country. If you look at the health department's first top 5 morbidity or mortality is one of them is malaria. So malaria is a big problem in our community or in this country. Health department spends huge amount of money on taking care of malaria complications, malaria problems and stuff like that in our community. There is very silent difference between dengue and malaria. But the main issue is that the causative agent, or the one that causes dengue, is viral, and malaria is a parasite. So they are different. The agents are different, but the clinical problems they cause are about the same. The same problems: fever, headache, joint pains, and muscle aches. And if you don't get treatment quickly, they go into problems. Especially for malaria, can cause infection in the brain called meningitis. It can cause kidney problems like kidney failure, which requires a long more treatment. So malaria, yes, is slightly different from dengue, but nonetheless they have the similar kind of clinical features.
And you touched a bit about treatments. What are some of the treatments you can get if you have malaria, and maybe if you can tell us some pros and cons of home treatments or traditional treatments versus the medical
malaria treatment. In Papua New Guinea, if you go to some local places, especially in the coastal regions, they treat malaria. Malaria commonly treat them with some traditional herbs and traditional booze herbs or leaves. Oftentimes, I hear people talk about pawpaw seed and all these things. It's individually or a different culture, different communities have their own different treatments. But what I know from a medical point of view, it's scientifically, okay, we talk about science here, we talk about pharmaceutical drugs that have been tested proper in the laboratories. These are ones that we advocate for. Say for chloroquine, it's still used, commonly, artemether, artesunate, and then they come up with the mala, which is the prescriptive drugs. But traditionally they use other things. I do not want to advocate for it. Maybe for fever, trying to cool down the fever on odd temperature. For bone, joint aches and muscle aches, they probably might use some of these things. But they are not that treatment against the parasitic, the parasite is causing this. So I will advocate for the public to go to hospital, get proper treatment, because we don't have down the track of resistancy, in malarial care in our country. So go to the hospital, get proper treatment, proper prescriptive treatment for that. What
are if not treated quickly, what are some of the things that you can experience or the ramifications of not getting treated right away?
If you don't get treatment, you carry around the parasite with you in the liver, in the bloodstream, in the spleen, inside internal organs, and sometimes they flare up again. But other ones, the ones that have a low immunity for malaria, they're going to develop in very severe form of malaria, which means that it might affect or infect the kidney and develop kidney failure. And kidney failure, to buy a kidney, it's about 250 or 300,000 kina. And we don't have this luxury. So people must understand that malaria doesn't cause some organ failure in important organs like kidney. It fails. Some of them go into the brain and cause cerebral malaria, meningitis. Yeah, so they can go to these kind of important organs and cause severe form of malarial complications. So we advocate that, malaria is malaria. Go quickly to the hospital, get treatment proper. And then, you get it out in the first instance. Otherwise, you delay and you get into complications. There's so much resources involved.
So what are some of the things you just like to highlight to our viewers as we have limited time left on the show?
It's a very big problem in this country. It causes mortality and morbidity, top 5 in the health system. And we need, it's part of our community. Malaria is here to stay. Quickly go to the hospital. Get the treatment when it's in the simple state. When you get into complication, it's too much effort, too much resources, too much things are used by the hospital to look after people. So when you have symptoms like fevers, joint aches and muscle aches, headaches, and you feel that this is malaria, go get tested for malaria blood slides, malaria tests, and if it's confirmed positive, get treatment. get hospital treatment, and you know that you can be cured down the track. But if you tried other things like purple seeds and other leaves, I have no idea, probably for other things, but my advice is to get to the hospital, get treatment.
Well, thank you so much for being with us on the show today.
Terry, thank you for that, having me around. Thank you very much.
Thank you.